So, because people are astounded when they realize the variation in cost from state to
Mm.
state.
Okay.
So, if you want a shock of your life, sit
Uh-huh.
down and look up the Genworth, that's Genworth, Genworth, big, big insurance company, Genworth Cost of Care Survey. And
Okay.
put in a year to get the right one. Okay.
Yes.
It'll take you to a website where you can put in your zip code
Uh-huh.
or your city and find out what the cost is in your area for home care, home health care, assisted living, skilled nursing.
Wow.
And the most expensive state in the United States is Alaska. It's something like 25,000 a month for skilled care. So
Wow.
the states that are most expensive, Connecticut, New Jersey, New York,
Mhm.
demand is high, California.
Yes.
But you can look for your area. Now let's say you're trying to relocate your parent and there's
Uh-huh.
several siblings that are saying mom could come live with me. Don't make that decision till you look at what the cost of care is in that area. Or yeah, so be educated about making that move. For example, New York has a robust social services,
Uh-huh.
excellent home-based community care services for their seniors. Florida does not.
Really? Mhm.
Yes, and don't make assumptions. Louisiana has better social services than Florida. So
Wow.
you just have to look and see what are the services that not just that they need now, but
Mhm.
will likely need in the future.
Right. Yes. And I think that that's what families, what they don't what they miss or they, for whatever reason, not aware or don't think of. It's not just the immediate need. It's just
Correct.
in the future. And I think one of my flyer my initial flyer when I first started this, and I don't even know how to make a flyer, but I made some makeshift flyer and it said, why do we wait until a fall or the fall? Why do we wait until after the fact? So, Star, what you're talking is so critical for families to hear, for elders to hear, for providers to hear. I think you're touching on some very important issues that are not discussed, and it's hard to find. And as I'm listening to you, I can't help but think about the family drama.
Oh boy.
So this one is not getting along with that one. They're fighting over this. They don't agree on this service. Oh, I don't think grandma or grandpa or mom or dad needs a hearing aid. I don't think they need a companion. I don't think they need this. Help us to understand. Did you address that as well in the book?
I have to tell you that when I wrote this book, which I'd worked on for those want to be authors out there who can't get motivated, it took COVID to motivate me to finish the book. Why? I was at home, right?
Yes.
So I thought, well, if I can't finish my book during COVID, then when I will never finish. So, but I did. And I was sort of in my own little bubble, as many of us were during that
Mm-hmm.
time. And I just wrote and wrote and wrote. Well, I had an entire chapter on family conflict and drama. And then when I realized how much I'd written, far more than the number of pages my publisher would print, that chapter and the several chapters got taken out.
Out.
I do address it somewhat because it's so pervasive.
Yes.
Harlem, if I wrote stories about the dramas that I
Right.
witnessed
Right.
in my 25 years in senior living, it would fill 3 books. It would be volumes.
That's another book, Star. That's another book. Yes.
It is. And let me give your podcast listeners a few tips too.
Uh-huh.
First of all, in my experience, all my years of watching families, there's almost always one person in the family, often a daughter, but not always,
Right.
who is willing to step forward and sort of be the leader in organizing or providing that care, or organizing that care within the family. However, I caution someone to take that on and become either the victim or or the person who has to bear that load
The
by
sole
themselves.
caregiver. Yes, that's a very
Oh,
common.
caregiver.
That's a
Yeah,
very common phenomenon, and you're right. Statistically, it's more than likely a daughter,
it
or
is.
or a woman. Yes, you're right.
It is, but not always. I've seen sons step up, and I've also seen sons be a primary caregiver and be excellent at it. So,
Yes.
but statistically, the research shows that it's often a woman. What I will say is, if you're lucky enough to have other family members, siblings, younger aunties, or anybody that's going to assist you, Zoom is a wonderful tool.
Mm-hmm.
And I think that if it's at all possible, I advise families to have, especially if you see a situation developing, meaning you see that your parent, you visit them and you see that a woman who used to be very neat in her appearance and in her hygiene is that
Mm-hmm.
now that's slipping. You
Mm-hmm.
see, God forbid, but you see pills all over the house, a sign of early dementia, and a million post-it notes everywhere reminding you of every little thing. These are red flags.
Yes.
You see they're starting to fall, or they used to be very social. Now they're not social. They're not showing up to those ladies' luncheons or going out and interacting with their friends. They have a little fender bender. Oh, it was nothing. I'm
Okay.
fine. It was just a little. So these are all red flags that you need to really look for. If you see that happening, that's the time to not wait for the crisis, like you said, and organize a family call without the loved one to begin with.
Right.
And you say, listen, I'm watching mom, or I heard from dad, or I'm concerned about them. I wanted to have a family discussion and have a plan in place to then reach out to your parents and involve them if they're able in that decision making, in that plan. And I referenced earlier, and I never said, how do you work with parents who are difficult or who are saying, I'm fine, I don't need any help? In my book, I talk about two that are foundational principles, Harlan, that families can use and people can use to guide them in this decision making. And the principle number one is, how can I help my parents, or myself, but how can I
Yeah.
help my parents maximize their independence for the longest possible time?
Okay.
So let's pretend we're having a conversation.
Yes.
If I were to ask you, pretend you're my older dad.
Yes.
So, Dad, I'm a little worried. I see that you might be having a few issues that I'm concerned about. And I want to ask you something. Is maintaining your independence, here's the question, the big question.
Uh-huh.
Dad, is maintaining your independence for the longest possible time important to you?
Yes.
And of course, what are you going to say, Harlem?
Yes.
Yeah,
Yes.
absolutely.
Yeah.
And
Absolutely. Yeah.
and then now you're in agreement. That's what I thought, Dad. I mean, I'm on the same page with you. I agree. That's the best plan of action. And you want to stay in, and usually this is a question,
Uh-huh.
it's kind of like an attorney asking a question that already knows what the answer is
Answer is
likely going
right.
to
Yeah.
be, right? So, and you want to stay in your home, Dad, for as long as possible. Am I right about that?
Absolutely.
Okay, that's what you're probably going to hear.
Mhm.
That's an assumption here. At which point you might say, well, I want that for you too. And so could you please at least consider if we hired somebody to help a little bit in the house to just come in? Remember, we're talking about not a home care companion to come in and help with cleaning up and maybe making some meals and helping as a companion or driving you to the grocery store. Wouldn't that help you maintain your independence to have a little bit of help rather than waiting for another fall if they've fallen or some kind of crisis with no help at all? Could
Mm-hmm.
you see, Dad, that might really help you?
Uh-huh.
And then you're trying to get them on the page where they're opening their concept about getting help in their home to stay in their home, which is what they want, to help them maintain their independence. Just a little help. I bet we could find somebody that you even know through your church, through your synagogue, through your place of worship, through your community, through your senior center. Someone maybe that you already know that could come in if you're hiring privately or not going through an agency that could come and help you a little bit. Are you open about that? So that's a strategy that
Yeah.
sometimes works.
Yes. Yes. Yeah. And You touched upon this earlier about the caregiver, the daughter or the son
Right.
or whoever it be, the family member, the loved one, taking on that burden solely. Why do we do that? Why do they do that? Why do we do that? Why do we take on, we feel as though we have to take all this burden on our shoulders?
Well, I can share with you from my own personal experience.
Uh,
My parents divorced and remarried, and I had a wonderful stepfather for 25 years. And in terms of being prepared, don't I wish I could go back to my younger self
yeah.
that with the wisdom I have today
Uh-huh.
to advise my younger self in decisions I made or didn't make. Because after my mom died, even though that wasn't what we thought was going to happen, and I moved my stepfather closer to me, was 6 hours away from me,
Hmm.
and he was in an apartment independently for a few years before he had to move to more care.
Yes.
And then my father and stepmother lived in New York City.
Oh, really?
And I was a long distance caregiver. He had Parkinson's and advanced Parkinson's, and then he passed away. And then my stepmother was alone and she wouldn't consider moving. And so everything I wrote about, I
Wow.
also experienced
That-
personally. And so I'll speak from my heart and say,
mm,
I do believe that people become caregivers out of
Okay.
love for that person, deep caring for that person, a sense of responsibility that they cared for me. They were a good parent or a good step parent to me, and I want to be able to be there in their time of need. Now, having said that, there's
Uh-huh.
a whole area of discussion. Well, what about if your parent was terrible? What if your parent is or was abusive?
Right.
What if caring for that person is the last thing in the world you ever want to
To
do?
do. Yes.
Now, I've seen people do it anyway.
Right.
Now, that's the question. Those are the people to ask why.
Right.
Well, one was a Buddhist and felt, that they couldn't look away.
Right.
They just couldn't
Right.
ignore the condition their stepfather was living in.
Right.
Yes, and they stepped up. Now they were able to financially to arrange for care and help for care, but I mean, to tell you that it was difficult or taxing would be a mild understatement. So everyone's situation is so individual. It's
Hmm.
so deeply personal.
Hmm.
Can't, but having said that, whoever is the primary caregiver, I'm going to
Hmm.
give you a startling statistic.
Yes.
62% of caregivers fall ill or pass away before the person they're caring.
No way. Really?
Yes. Yes.
Wow.
So, given that statistic, my advice to the caregivers out there is remember, you will be doing no one a favor,
Oh, yeah.
yourself or your loved one,
Right.
if you drive your health mentally or physically into the ground. So don't take on the role of caregiving if you know it's going to destroy you. You can't, you have to come up with a different solution, some other problem, which is why I wrote the book. Don't wait for the crisis. Sit down with your parents when the people say, well, what's the perfect age to start talking to your parents? And the people are shocked when I say, before they retire,
Yes.
55, 60. Those are very soft questions to start with. Mom, Dad, I know you're retiring in 10 years. What are you thinking about? Are you going to move to Florida?
Right. Right.
Are you
Yeah.
going to stay in Massachusetts? Another
Hmm.
very expensive state.
Hmm.
DC, even more expensive.
Hmm.
What have you, and they may not even know. And you can say, well, why I'm asking is because I just see my friends whose parents are older than you, and I see my friends struggling with these decisions and these crises. And I would like to know what you want. You're not telling your parents what to do at that point. What
Right.
you want,
Right.
what you're imagining. Could
Right.
we maybe come up with a plan together and start talking about it? Because it could take years.
Right. Yeah. Wow. This is, I'm so happy we're having this discussion, Star.
There's so
I mean,
much to talk about.
yeah, you're just sort of hitting the nail on the head in every angle that and we do have the subject matter experts. We have the attorneys, we have the physicians, we have who are specialists in their own respective disciplines. But what you bring, I think, to the discussion and to the table is sort of this, it's looking at the nuance in all these different areas that are not discussed. And you're not going to get a doctor to help you talk about this, and
No.
yeah.
Well, there's one other resource I want to mention. I'm not sure what kind of time frame we're on and how long I could go. We could stay here all day. But a lot of times people say, well, I'm a solo senior. I don't have anybody. I have no family, or I'm estranged from my children. Or as I like to say, your children aren't willing, able, and capable.
Right. Those are
So
those. Yeah.
and
Mm-hmm.
then what? How can I build a support team? Because I talk to seniors all the time about how strong is their support team and how can they build that support team up. So I'm a member of an organization which I'm such a fan of called the Aging Life Care Association, ALCA.
Okay.
Aging A Life Care Association.
Okay.
ACLA, Aging ALCA, Aging Life Care Association. And I'm somewhat a newbie in that organization, just a few years. But the organization is made up primarily of geriatric care managers. And even though people hate that word, geriatric, let's
Yes.
remember that this person could make the difference between you aging successfully or not. Meaning that this is someone who you could hire to assist you as your advocate in the hospital, your advocate with your doctor when you're in
Mm-hmm.
crisis,
Mm-hmm.
help you in a time of crisis,
Mm-hmm.
hire a home care, home health agency. They're not the person that's going to come in and make your sandwich or help you with dressing or bathing. They're the person who are the experts who are going to come in and help you make a plan. I tell people it's like the daughter you wish you had, or the daughter in your town when your daughter's on the other coast from where you live.
Mm-hmm.
And if you go to the ALCA website, you can put in your zip code and see biographies of all the people who are in your area. And usually they come from either a medical background, Harlem,
Uh-huh.
or from the social services background, licensed clinical social workers, mental health people, or the medical side. So depending on your need, that you may lean one way or the other. But can't say enough good things about that organization. When you are finding yourself in need of an expert, as an advocate that knows your community, facilities you would never go to, or the best facility to go to, or even specialists, excellent referrals for doctors, any kind of home care, home health care. So there are people out there that are trained and able and very capable.
Yeah, that actually term and that title came up in a previous interview. Geriatric, you said,
Yes.
counselors?
Care
Yeah.
managers. There is
Care
a
managers, yes.
certification. It's for either geriatric care managers. There are various other organizations. ALCA is not the only organization, but
Mm-hmm.
they are a national organization that are really, I think, leaders in this field. And I try to educate people about this as an option because there are a lot of young people who love working with seniors. And if they knew that they could build a career in
Mm-hmm.
that area, either a solo practitioner or somebody in a larger company that was providing this kind of care, they would be happy to hear about it. So,
Mm-hmm.
and let's face it, demographically,
Mm-hmm.
the
Mm-hmm.
silver tsunami, all those
Yeah.
baby boomers, of which I am one, that demographic is just growing and growing and growing and growing. And they will be in need of advocates and support, people on their support team and people to help them.
Yes, fantastic. So I have one burning question, and this is based on our preliminary conversation. And I love the way you defined it. Go, the different stages of, yes, please share with me about go and yeah.
Yeah, it's a wonderful short way of helping people kind of think about
Mm-hmm.
themselves or their parents. What I usually say to people is, post retirement,
Mm-hmm.
most people are in the go-go years.
Mm-hmm.
But after the go-go years come the slow-go years and then the no-go years.
Mm-hmm.
So what do I mean by that? If you said, what's the biggest mistake you think adult children make? There are many, of which I made them as well. So no
Right,
finger pointing here, right?
right.
But it's making an assumption that your parents are going to stay in the go-go years. For example, people say to me, well, I don't understand. Dad was playing golf 5 days a week, and mom and he were traveling all over the place, or they were so active in their community doing all the, and now something happened to dad and he's down for the count. He had a little stroke, a bad fall, and now they went from go-go to slow-go. Or as I said, there's no rule that says you have to pass through slow-go. Slow-go means you're not traveling as much. You're not going and driving all over the place. Maybe you're not traveling at all. You're still independent. You still have your mobility, but your world is shrinking.
Mm-hmm.
Maybe as an adult child, you're seeing a few red flags that I talk about in the book to look for. And the no-go, that is when you either need care in your home,
okay,
or you need care in a facility. No-go, your mobility is compromised. You might be walking with a walker. You might need some assistance in your ADLs, activities of daily living.
yes,
Criteria that assisted living is going to look at. Bathing, big one, medication management, dressing yourself, being able to handle your life. But if you give someone like that support, either at home or in assisted living, then they can maintain their independence.
Wow.
With some support and help.
Wow. So there's a lot for us to unpack and continue discussion, but I want to close out by asking what recommendations you have for our listeners.
The first thing I thought was read my book.
Yes.
Oh, and put a review on Amazon, please.
Sounds great.
But honestly, here's what I will say. Everyone is so busy in their lives, working sometimes more than one job, or a couple trying to bring up their kids and their family and honor their commitments in their professional lives and in their children's lives, that often they do wait for that crisis with their aging parents. Like I said, they're doing great. They don't need any help. And they don't realize that that's likely going to change. And if they want to be a little more prepared, then they need to address the issues you and I have been discussing this morning. The medical documents, not just a living will, making sure your parents have a living will, absolutely critical, a healthcare proxy, legal documents, having these discussions early, way ahead of when you think you should, so that you are prepared. If people could understand the headaches they would save themselves, the stress and the trauma of waiting for a crisis, if they could just have some discussions with their parents long before any crisis, with their siblings, long before a crisis, they would be able to handle what's coming with far more grace and knowledge and education than waiting for that crisis. That's my message. That's why I wrote the book.
Oh, wow, Star. This has been such a terrific interview. Star, how can you and I champion this effort?
Oh,
How can we get the word out there? How can we go ahead and sort of continue to share your wisdom, your knowledge, your expertise to the families that are struggling, who are beating themselves up to say, I want to give dad or mom everything they want and everything they need and everything they fight for, but it's taking a lot out of me and I don't have the time, and to help them, to position them to find that balance, because quite often it's too late.
right.
The parents did not, whatever relationship or dynamic that occurred, they did not have this discussion early. And now, dad is having difficulty to go upstairs, or mom
Right.
fell, and what's next? So,
I guess what I want to say is, first of all, you're doing that, Harlem, with your podcast, and a podcast is a tool to get the word out and spread the word and help people learn and become educated. And from my perspective, I would say start the conversation early with your parents. And again, you can always blame My friends are going through a real crisis with their parents. And I realized, and of course, parents are more apt to listen to you as their beloved child, hopefully, because they're worried about you. They don't want to
hmm
upset you. They don't want to make you anxious. So make it about yourself.
Right. Yeah.
I'm worried. Not you need help. I am worried. I don't know what you really want because we haven't talked about it. I don't know what your plans might be when you want to retire.
Right.
I see my friends not knowing how their parents are going to pay for long-term care. Maybe you've already thought about this, but we haven't talked about it. I don't know what you don't start out with this one. I don't know what your end of life wishes are, but could we talk about that? That's a hard one. You save that 10 questions after. What are your plans to retire? Are you going to stay in this house? Because, gosh, there's no bathroom downstairs.
Yes.
What if you couldn't go up the stairs? Maybe you should think about moving, maybe long before they're actually retiring or in the slow go years when now they can't go upstairs and there's no full bathroom.
Right.
So it's really taking on the responsibility of starting those conversations early
hmm hmm
and read my book.
Well, fantastic. I'll be sure to have that book posted, with at least a website, on my
Thank you.
eldercareproject.com.
Thank you. Spread the word. And, if we want to do another interview, because I have a feeling we could keep talking, we could do an entire program on what is a life care community? What is a continuing care retirement community? And why would anybody consider that? That's probably the longest chapter in my book. And then a final exit plan. I mean, that's even a
Wow.
tougher. What if you
That
knew
is
your parent was dying?
that
How
is
could you
so
support that?
difficult. We have to do it. We have to do another session.
I'd love to,
That,
really.
that is such an extremely sensitive challenge, and in so many words, spiritually, emotionally,
Absolutely.
financially. So let's just continue this
Okay.
discussion. And
Okay.
I can't thank you enough, Star, for
Thank,
your
thank
wisdom,
you.
for your time, for your dedication, for your book.
Well, we're passionate about this. You can tell I am, and I know you are. And so we just have to keep working, keep getting the word out.
Yes, yes. Thank you. Thank you very much. And we'll be in touch.
Okay.
Okay?
Bye.
Okay, bye. Take care.